there. Thank you for joining me on the program. Your doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue to have our conversations around the COVID-19 pandemic as it continues to ravage the world in its path. Today, we are very happy to have vaccinated over 150,000 people in Guyana, and we are grateful that we still have vaccines. Although we have a long way to go, we are on the right path heading in the direction of vaccinating our population. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. As usual, I'm starting off by wearing my mask to cover both my nose and mouth, but for the rest of this program, as we continue to chat, I will take it off. But first, I must introduce you to Ms. Tamika Rodney from HGTV Nightly News, who has graciously consented and asked to be here so that we can have a frank discussion about the COVID-19 pandemic, the vaccination program, and other relevant information regarding COVID-19 in Guyana.
Have we recorded any cases of reinfection? And if yes, how are those cases dealt with?
Great question. So far, around the world, we have had over 155 million people testing positive for COVID-19. Let me repeat that number. 155 million across the globe. Yet, the number of reinfected cases haven't really reached 1,000. It's probably 100 or a couple of hundred. So the chances of reinfection across the globe are very low. In Guyana, in the early days of COVID-19, we had 2 or 3 suspected cases. Now, are they real or not? It is quite possible in the early days our testing may not have been as accurate as they are or as improved as they are now. And it is possible we may have had a false positive here or false positive there. But just worldwide statistics, it makes it very unlikely that we in Guyana would be the unfortunate country or population to see rapid numbers of reinfection or massive numbers of reinfected cases. So it is highly unlikely. We have had 2 or 3 suspected cases, but none that I can say we have confirmed with any certainty or definitive answers.
Now, I understand that none of the vaccines provide 100% protection from persons contracting the virus. Have we recorded any cases of persons who were vaccinated, at least given the first dose, but still contract COVID-19, apart from the 30 persons you mentioned earlier?
So I'm not sure that we... So what I mentioned earlier was the admission to the ICU.
Yeah.
So we have had no one admitted to ICU who had more than 3 weeks of their first dose. No one, right? But we did have persons testing positive after getting vaccine. But those persons generally, and to the best of my knowledge, they would have recovered or are recovering. They would not have had severe COVID requiring admission to the hospital ICU. Even if they were admitted to hospital, they were admitted, sorted out, and discharged in short order.
Can you say how many persons?
It's difficult for me to tell you that number off the top of my head, but I do know of at least 3 or 4 cases.
Treatment options such as remdesivir, convalescent plasma therapy, these have all been offered to hospitalized COVID-19 patients. Are they still being used? And how effective have they been considering vaccination has started?
Yeah. So again, in the early days, we tried to use everything we have that showed some benefit. And the hope was that once it doesn't cause harm to these patients, that we can have cumulative small amounts of benefits that, add up to keep people safe and out of hospital and not dying. The principle has always been sound, the general idea has been sound, and essentially you're doing what you think is best for your patients, weighing risks versus benefits. Convalescent plasma is still being used, albeit in a more streamlined, more specific way these days because we have had, emergence of new evidence, etc. Remdesivir is still being used. Those are being used in the less severely ill patients now because we know from evidence that has subsequently came to light that it is better to be used in the mild to moderate symptomatic patients rather than the severe patients. So again, careful patient selection. We use what we can in these patients. Most recently, people have started around the world to start use ivermectin. Again, we use what we have. Once it doesn't cause harm to patients, we start to use them in patients, even in Guyana.
So those patients who are hospitalized, not ICU patients, but just hospitalized COVID-19 patients, are they offered the COVID-19 vaccines?
Right now, we do not vaccinate people with active COVID infections if it's known. But I'm certain that we would have had many persons with asymptomatic COVID or mildly symptomatic COVID who got the vaccine. And we have not seen any overwhelming reports or about bad outcomes for those persons across the world. But our guidelines generally is for people who would have had COVID to recover for at least 90 days before you get your vaccine. That's not based on safety or anything else. It is based on a simple principle that you had a limited number of vaccine. And if people recover from COVID-19, then they have antibodies, some kind of protection to COVID-19. So you would rather then give the vaccine to someone else who has no protection to COVID-19. But as we get more and more vaccines, we would want to, revise those kind of timelines. And I want to talk about the availability of vaccines as an important thing to consider. There are many people in Guyana and around the world who may want to wait a little bit more before getting their vaccines. And I want to caution a little bit because we see what's happening in India. And a lot of the vaccines, a lot of the vaccine components, even for the Pfizer vaccine and Moderna vaccine, they are produced in India. And if India becomes overrun and they're unable to supply the world with medicines and vaccines, etc., then it will become scarce. It will become harder for us to access those resources. And so now that we actually have vaccines, I would encourage that people actually take advantage of it before it actually becomes a luxury to get a vaccine.
We have received some concerns from persons over the low level of expert care at the Liliendahl Hospital. Some persons believe that once you hit that hospital, especially the ICU, there's no turning back. You're basically going to die. Can you say what type of care is being offered at that hospital? Kind of walk us through the process. Once you're admitted there, what happens?
Yeah, so it's not accurate to say that there's low-level care at Liliendahl. The doctors there are highly experienced. In fact, the ones who are assigned to manage COVID patients have more experience in managing COVID patients than most doctors around the world because that's what they do every day. And you learn from one patient to the next patient. One week you start off at one level and the next week, because of volume, you are better. And these doctors and nurses and healthcare professionals, they have been learning to do this for more than a year. So to describe them or to describe the care as low level would be completely inaccurate and false. The assumption that people getting into the ICU is the end is completely false as well. Every day they discharge people from the ICU there, back to the regular ward and then home. Couple days ago, when we celebrated 100 episodes of this show, I had two survivors who were both in ICU that are here today to have this interview with us. So the majority of people actually come out of the ICU. We still have across this country a 2.1% case fatality rate of COVID. which is at the lower end of the world average. The world average is between 2 to 3%. So getting into the COVID ICU, it's a horrible thing. It is a daunting thing, but it is not a fatal or a fatalistic expectation only. The majority of people who go there get better and are discharged. So just to be clear and clarify that assumption.
Thank you for that clarity there. Shadow Public Health Minister, or Shadow Health Minister, Dr. Karen Cummins, in an interview with us recently, suggested that in order to motivate persons or the younger persons to get vaccinated, she is suggesting that government should start giving some type of monetary incentive to persons to take the vaccines. What are your thoughts on that?
I'm not sure that that would pass all of the medical ethics involved to incentivize people to take a treatment, which still is an optional treatment for people. You still have the right to say no. You still have the right to make your own decisions. We don't want to induce you to make decisions because of some monetary incentives. The repercussions for that can be quite far-reaching. And I'm sure Dr. Cummings has all good intentions. We're just trying to get more people vaccinated. So we're on the same page with trying to get more people vaccinated. The approach may be a little different. And so I would hesitate to incentivize. But that being said, we know that the world in several places is moving towards a requirement to produce vaccine passport. So you have to demonstrate that you're vaccinated, for example, to go out in certain public spaces, to get on an aircraft, to go into, certain environments. For example, recently, Israel has allowed people to gather in public only if, without masks, that is, if they can show their vaccine cards and demonstrate that they have 2 doses of vaccine. If we are going to get back to any semblance of what is considered normal, the vaccination seems to be our best shot at this time, no pun intended. So get as many people as possible vaccinated. That's our chance to get back to what we consider normal.
So you're basically endorsing the vaccine passports?
I'm just telling you what's happening.
Yeah.
It might be that people will go in that direction. My opinion on it is neither here nor there. I haven't had time to formalize and study all of the implications of it. But I do know that, the vaccinated person is less a danger to society than the non-vaccinated person. And if you are vaccinated properly, then the chances of you becoming sick and utilizing scarce resources are less. So there is some merit in treating vaccinated people different from non-vaccinated people.
Dr. Carpen, thank you so much. Those are all of my questions.
To our viewers and listeners, thank you once again for joining me on the program, Your Doctor and COVID. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me.